For many women, getting pregnant is a time of excitement and of celebration. But for those with chronic health conditions, carrying a baby can be terrifying because the life-saving medication they need is off limits. Now, there's a push to change that.
They're the common conditions ranging from asthma to diabetes, depression to hypertension, treated as a matter of course in doctors' offices around the world each day. But for expectant mums, managing those everyday illnesses can become a tightrope walk, all because pregnant women have been excluded from the clinical trials of 90% of globally available medications.
Certainly historically, I think the main driver for that has been thalidomide. In the wake of that, there were really significant regulatory changes that occurred that essentially have excluded pregnant women from clinical trials.
Doctors call it best guess treatment because there's little to no data on the impacts of most drugs on a growing fetus, leaving GPs to weigh up the balance between mum and baby's health.
They might be on really fantastic medications to control those diseases outside of pregnancy, but due to a lack of data, we need to change those medications. And I think it really does cause significant stress and anxiety that pregnant women really don't need.
And the consequences of this knowledge desert can be tragic. The little research that does exist shows when women lower or stop their meds, the resultant flare-ups actually increase the chance of miscarriage and risk mum's life too.
For some time now, there's been a very cautious approach to the involvement of women in medical research, particularly about medications.
Now, a growing chorus of health professionals is calling for change.
I think that it has been harmful for pregnant women, this protectionist attitude. It's meant that they're left in this really difficult limbo.
It's really important that women are involved in that process and get the most up-to-date information available about the safety of new medications in pregnancy.
Well, Professor Margie Danchin is a paediatrician and a researcher involved in this space. She joins us now. Professor, of course, we need much more research in this area, but are there many mums actually putting their hands up offering to be guinea pigs?
Absolutely. In fact, at least 30% of pregnant women or gender-diverse pregnant people are happy to put their hands up to participate in a clinical trial for a new drug or a vaccine. And they don't want that decision to be made for them. They don't want to be forced to choose between an untested medicine or vaccine and the risk of a disease or a condition, a vaccine-preventable disease that affects themselves or their unborn baby.
Well, it seems bizarre that if these women are willing to put themselves through the clinical trials that they wouldn't be allowed to. Why are they refused?
Essentially, pharmaceutical companies perceive the risk of giving new drugs and vaccines to pregnant women as too high. And that's partly a hangover from what happened with thalidomide in the 1950s and 60s. But the other thing that's really important to think about is that there's so much better preclinical testing now in animals. So, for example, the thalidomide situation would not occur because the birth defects and the limb loss would be identified in the animals before it got anywhere near a human. So the risk framework has changed, and also in the trials themselves, the regulatory oversight and monitoring is so much more rigorous now. So in fact, the risk is much lower to the pregnant woman herself before, she even goes into the trial.
Margie, what kinds of health impacts does this lack of knowledge have?
Well, that is the biggest issue here, is that, in fact, women are unable to make the best choices for their health, and they're unable to access the best treatments. So they either say no, or they stop taking the best treatment because they're not sure about the safety profile, or they take suboptimal doses, or the worst outcome is, in fact, they take old treatments, so they're not accessing the most modern and innovative therapies for whatever the condition is, and there's sometimes shortages of those drugs because they're old and the companies don't want to make them anymore.
If these trials happen, would there be flow-on effects for health conditions that aren't chronic health conditions? Like when I was pregnant and I got sick, and they tell you, to cure your cold, go and stand in the sunlight and drink some hot lemon because you can't buy that over-the-counter cough medicine. Like, you can take nothing when you're pregnant, and I'm sure these things are not going to harm your baby. They're just being super, very precautious about what they put on the labels. Would this help those conditions as well?
Absolutely, and as you say, you know, there's a very strong regulatory framework for drugs and medicines, and, you know, over-the-counter medications like you just referred to are generally perceived as very low risk. But some of these, you know, autoimmune therapies and other drugs that treat really nasty conditions, of course, have side effects like any drug or vaccine. And we feel very strongly that this decision-making, this risk framework, needs to change. It is absolutely time for pregnant women to make the decision themselves. You know, I think this sort of paternalism that we see is really gender biased, it's discriminatory, and in fact it's causing harm because they can't access the best treatments.
Okay, Professor Margie Danchin, appreciate your time. Thank you.
No problems. Thanks for having me.